Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the big town of Wallace, Idaho, on our way to Montana. And we are super excited to have Dr. Kelsey Smith on our podcast today. She was on our podcast 3 years ago, I believe, maybe 4 years ago. I'll have to verify that with her when she first started her DPC clinic. And for those of you that follow us, you guys are familiar with DPC, a membership-based clinic where patients pay a monthly fee, a very affordable monthly fee, to have 24/7 access to their doctor. And she has been very successful. I'm super excited for her to share her story. So Dr. Smith, welcome to our show.
Thank you. I'm excited to be here again.
So tell us a little bit about your history. And was it 2021 or 2020 you opened your clinic?
I opened January of 2021, and I think you guys actually had me on your show right before I even opened, before I started taking DPC patients. So you guys were one of my very first supporters. So thank you. I think it was December maybe of 2020 that we talked about how and why I was making the leap to begin with. So
that's right. I was thinking it was 2020. And that's why I was kind of thinking it might have been almost 4 years since you've opened, which you've had that thought in your mind for a while now. So tell us how it's going.
It's going great. It hasn't necessarily gone exactly as I had planned. If I had had a 4-year plan, back in 2020 when I was thinking of opening, but it's been a great adventure and things are still going great. I think that's one of the things I had as a question in my mind when I planned this was, well, is DPC really a viable business option, or is it just a way to really stick it to the man and, be a rebel? And then at the end of the day, you're going to run out of resources and have to go, with your hat in your hand, begging for a job at some hospital system. And I think that's one of the biggest things I would tell doctors that are thinking about doing this is it is a financially viable business option. It's not just a way to, try to make a statement, a political statement, or whatever you think it might be. It really is a viable business option.
Well, and you have a family to support, right? So it had to be a viable business option for you, correct?
Yeah, I mean, we're a 2-income household, so that made this transition easier. But yes, we didn't have to necessarily sell our home. There wasn't, we weren't close to, bankruptcy at any point or anything like that. It has been financially a success. If that's one way you judge success, like we were talking pre-show, is what is the measure of success? But we have been able to make money, which some of my patients, because it's so affordable, that's one of the concerns they've had is, Dr. Smith, I've had people ask me, well, how in the world are you going to make any money at this if you only charge me $85 a month? What am I missing here? And it does actually work when you realize that healthcare doesn't have to be that expensive.
And let's speak about success, because there's a lot more definition to success than financial. And if somebody asked me, especially now, in our career, how important the financial part is of your business. I mean, we've created a great lifestyle and a great business, and we've been doing it for a long time. But I will tell you now, especially at this point in my career, money is the least important part of my practice.
Right.
Success to me is, are you liberated? Do you like what you're doing? So what is success to you as a doctor?
Yeah. So I think part of the success that I feel is just having had the opportunity to introduce this model to my community, where really no one had heard of it before, and people are still learning about it, who are like, I knew you kind of struck out on your own, but I had no idea what this was all about. And just kind of had that conversation with a friend who had moved out of state, who was finally realizing the advantages of direct primary care. And I helped them find a clinic close to them. But they say, yeah, I knew you were doing this crazy thing, but I didn't really understand why, until they start seeing the pain points of the modern healthcare system for themselves. So I think one of the biggest measures of success for me then has been showing people that healthcare doesn't have to be such a painful process. You can have that relationship with your doctor like you might have, only thought happened in the Marcus Welby episodes, and things like that. That you can call when you have a concern and not have to Google doctor everything, and get an answer. So that measure of success has been really fun. And that's where it's been hard to figure out at what pace do we grow and how do we continue to succeed in that way by sharing this idea that we feel like is working with more people, more patients, and potentially more doctors without losing the secret sauce. We don't want to push it too far too fast.
Right. Exactly. So Janet, what questions do you have for Dr. Smith?
So you touched on a really good point is the growth factor, because I think most people consider what you're doing kind of an outlier. And we know that there's more people doing it. So you've had to manage growth. So talk a little bit about how that worked.
Yeah. So when I was considering this, I knew I needed 2 people by my side to make it work. I needed my husband on board, and I needed my medical assistant that has worked with me for years to be on board with this if it was going to be successful. And my husband, thankfully, was supportive of the change. He's a pilot, so he is inherently not adverse to risk. He was like, yeah, give it a try. It'll work or it won't. And then my medical assistant, I took her to meet some other doctors who were practicing direct primary care, and she thought we were all crazy. But she said, I'm by your side if we want to make this work. So she and I launched the clinic and grew it in the first 2.5 years on our own. And then we got to a point where, as we talked about, you either have to close off enrollment to new patients to be able to continue to provide the services you're promising and the quality that you're promising, or you have to find a way to become more efficient. So I actually was approached by an employee that had worked for the hospital for 30 years, and she knows the ins and outs of healthcare extremely well, and asked if I was hiring. And I told her, I'm not sure I can afford you. You have quite a bit of healthcare seniority. And surprisingly to some, probably not to you guys, but she said, what, I will take a pay cut. I can't continue to work this rat race like I've been doing. And I see what you're doing and I want to be a part of it. So we brought her onto our team. So now I have 2 full-time employees. And then the next way I grew was I have a friend that she's a fully licensed physician, but because of kind of the just life and the things that happen, circumstances, she was not able to fully finish a residency. So she's not board certified, but she is fully licensed and had been trained as training to become an anesthesiologist when she had to withdraw from her residency years ago. And strangely enough, you would think if you have your medical degree, you would be in high demand for all kinds of healthcare positions, but just politically and things like that, that's not the case. You can have your PA degree or your nurse practitioner degree and no specialization, and you can work in all kinds of different settings. You can jump from a cardiology clinic and then go work in a dermatology clinic and then decide, no, I want to work in a radiology setting, and there's no problems. But for an MD that hasn't finished their residency training, you're essentially unemployable because you can't get credentialed by insurance. And since we don't deal with insurance, and I knew she was perfectly capable from a skills standpoint, I was able to give her that opportunity to come work with me. And she only really wanted to work part-time anyway. So she doesn't have her own panel of patients, but she functions in my clinic somewhat like a mid-level, even though she's a fully trained physician. And she'll see people that need to come in for a sore throat, but I already have someone scheduled during that time. So it opens up our availability. So now we've grown from a family of 2 basically in the clinic to a family of 3.5. So and looking to grow even more. The new clinic, and I'm sure we'll talk about that, but it will have room for between 4 and 6 full-time physicians, and hopefully we will find the people who would be a good fit for that over time.
Wow, that's exciting. I love that you're preparing for growth like that. So some quick questions during your startup. So how did your practice as a physician, how different was it when you first started up compared to when you left your last clinic seeing patients? How different was it? I guess what I'm saying, from the process of checking patients in and all that, all you had was an MA.
Mhm.
So you were it, right?
Yeah.
And
Well,
so tell me about that.
my transition was a little different than some because, like you say, most people are walking away from one work life and then starting day one at another. And I was fortunate in that I was already in private practice, so um, with some partners, but we all ran our own practice fairly independently, even though we were under the same roof. So when I decided to do direct primary care, I approached my other partners, thinking I would be somewhat of a test case, to say, I'm going to do direct primary care and hopefully it's a success. And you all can then join when you feel comfortable, and we'll transition this whole office of 5 physicians to a direct primary care model. And, so that was kind of my original plan. That didn't necessarily pan out, but they were perfectly fine with me changing business models, but staying in the same physical space. So my patients continued to come to the same place they always had. And I used to deliver babies. And so I needed to get all of my patients who were pregnant delivered before I stopped taking insurance altogether. But yet I wanted to launch my direct primary care practice and start building that panel. So there was a time of overlap. So when I look back at 2021, when I launched my direct primary care practice, I was taking on direct primary care patients, and we had our DPC schedule, but I also had my insurance-based schedule that functioned completely independently under 2 different business models. So we had 2 different separate calendars. When people showed up, we didn't, had to figure out, okay, are we seeing them in this model or that model, and make sure we didn't double book ourselves and stuff. So for the first 7 months of our DPC practice, I was essentially working 2 jobs and kind of winding down my insurance-based practice while we were ramping up DPC. So my patients didn't necessarily see much of a difference. Once I had transitioned completely to direct primary care, we had to sort out the expenses in the office, right? So I no longer employed the receptionist up front. So we had to figure out, well, how do my patients even let me know we're here, since I don't really want to pay those receptionists either, that they belong to the rest of the group. So we put a little sign out, cute little sign in the lobby that basically says, if you're here to see Dr. Smith, hit the button, and it rings a doorbell back by us. And that way my MA knows to go out and grab them from the waiting room. And typically it's a much quicker response time than the people who are waiting to see their insurance-based doc, who are my old partners. So it's, there's sometimes simple solutions for things that you might fret about when you're sitting there going, well, how am I going to do this? And how am I going to do that? You just keep putting one foot in front of the other. And sometimes the solution that works doesn't have to be super technologically, complex or shiny. It was like a $20 little intercom button off of Amazon, and it fixed that problem. So.
Right. One thing I love about DPC is every story and every practice is so different because you're not billing insurance. It allows you to have freedom to run your practice how you want to run your practice. And, so not only from the fees you charge, but from how you check in patients. And I love that story. So now, are you still in that building now before?
Yeah.
With your other.
I am.
Right. You are. So not until your other building is up will you be out of that building.
Right. So you can see behind me, this is my same office space I've been in. When I was billing insurance for 14 years, the only thing in this room was my desk, and anything I wanted. It was my personal office. I had a bookcase, some different resources. I think at one point I had a little Chase lounge for when my kids were sick and could come stay at mom's office while I was seeing patients and things. But as we started growing, we really didn't have room to grow either. As I added, like say, we're now went from a family of 2 to 3.5. I had to figure out how to fit everybody into this same space. So I got rid of my big executive desk that had been in my doctor's office, and again, went to Amazon and found some of the, pretty streamlined desks that we could put against each wall. So we have 2 desks on one wall, a 3rd desk on the other. So the same office space that I thought was cozy for myself, it now houses 3 workspaces. So you like I say, you make the most of it and you become efficient. Oh, and our pharmacy behind me is in the same space. So and a mini fridge. So we
your office is full.
It's full now. Yeah. I think we've maximized the space at this point. So.
Yeah, right. And so tell us about your new your new building
Mhm.
and the vision for your new building. You kind of tease us a little bit about that, but tell us
Sure.
how that's going.
It's going great. And, I wouldn't have anticipated that's where we would be at this point either if you'd asked me 4 years ago. In fact, when we started looking for more space, I think I was frustrating. I know I was frustrating my husband because I was looking at space like old homes in residential areas that maybe we could get rezoned to commercial, and I could make this little bedroom into an exam room, and my husband was like, this is ridiculous. You have a real business, like you need a real business building, you need a real clinic. And I'm like, but I don't really need anything fancy and all this stuff. So he was the one that had a little more of a vision for having a true professional office space. And I think he was the first one that said, if we can't find something like that, because we're in a town of 50,000, there's not a ton of clinic space that comes up for sale that's really just like you want it. So it is going to, even if it is a commercial space, it's going to take quite a bit of remodeling to make it work. So he was the first one to say, well, maybe we should just build. And I really didn't think that was a great idea. That seemed like an insurmountable challenge. He said, well, then you'll get exactly what you want. And I said, well, that's the problem. I don't know exactly what I want. I've worked in healthcare for this length of time, but that doesn't mean I can design a clinic. Anyway, but we found commercial space that was within a mile of our home. We kind of negotiated on one lot, found it was too small, negotiated for a second lot, sold the first one back. It's a process. Nobody, if you're on the outside looking in, it might look like we had this master plan. But that's kind of like following your friends on social media. Everybody looks like they've got it all together, but it really is a process of figuring out, okay, well, what are we going to do with this lot and how are we going to make this work? And I designed the space thinking I was going to have another business partner in that space. So it's probably twice as big as I really need right now. But we've got plenty of, ability to pay the bills for right now. So if you build it, they will come, as kind of the thought process. And hopefully we'll find physicians that have the same philosophy in mind, because direct primary care isn't for everyone. It's not for every patient and it's not for every doctor. But we want to, I think we're providing a space where we can grow so that those physicians or doctors who want to be part of that will have the opportunity.
That's a great idea, to build for growth. So Janet, what kind of questions do you have for Dr. Smith?
Well, that's a great point, because I think when we start talking about comfort zone of practicing, I think that's kind of the realm that doctors are kind of in, of not being sure whether or not it's a good transition for them.
Yeah.
So what would you say to what kind of person do you think is going to be drawn to direct primary care? Because I think not everybody's going to fit.
Sure. And not to say that all direct primary care doctors fit the same mold, but I do think we have certain characteristics as clinicians that make us a good fit for the model. I think the first is just if you're a physician and you're working day to day and you feel like you just never have time. You never have time to spend enough time with each patient. You never have time to, finish your charting the way you want it to be done. You just feel like that you wish you had more time. That's kind of a common theme amongst direct primary care physicians. I was never the type of physician that felt like I could feel comfortable and confident that I had addressed all the issues in the room in a 10-minute visit or less, depending on the schedule for the day. And always had this gnawing feeling in my stomach that, gosh, I really could be missing something here. And so if you're the kind of person that you really enjoy that fast pace and like to see 30 to 50 patients per day, like some physicians do, and you thrive on that, fast paced, interactions, stay in insurance-based care. There's really no reason to move over if you're not struggling there. But I think the majority.
I got to ask.
Yeah.
I'm serious. There are physicians that like that. Seriously?
Well, I mean, yeah, my partners do quite well in that model. I think they thrive on the fact that they know exactly what their day entails. They've got, I'm going from this room to that room, and this is what we're talking about. And it's very straightforward. No, we're not going to talk about, how you got food poisoning at age 10 when you went to Mexico. We're going to talk about your hypertension because we've got to be focused. We've got to be, we can't get off topic. And so I think they do like that, in that it keeps everybody on task. And if you open yourself up to a more fluid schedule where you don't really necessarily know how many things each person's going to talk about when they come in, that's a scary thing to some clinicians, I think, rather than being very task oriented and task based, where, it's like, no, this is what we're covering today. Anything else I can shut down, and in my clinic, there's no telling how many things we'll address in one visit. In addition to, I think that's what's scary to a lot of folks considering DPC as well, is I might only have 10 people on my schedule, and that's considered a busy day for me, but I'll have people texting all day long or sending emails all day long. And, we may or may not be able to address those remotely, but, and I might do a telehealth visit or a home visit at the end of the day. And I think that nonlinear type of schedule where you don't know exactly what the expectation is at the beginning of each day is a little distressing to some people, rather than just point me in the right direction and tell me what's next. So I deal pretty well with that nonlinearity of my schedule. I had somebody pick up my cell phone the other day, and I'm a person that really isn't bothered by the red dots and the notifications on my phone. And I think she about had a stroke. She was like,
that's notifications on my phone bug the heck out of me.
Yeah, it's like
one
way or the other, right?
The only thing that comes up on my phone notifications are text notifications.
Yeah,
that's the only thing, and I won't let those stay very long. You'll have notifications in her emails and stuff. Thousands.
Yeah, me too. I'm right there with you, Janet. Yeah.
I organize them, depending on what it is, it goes to a file, and then I go back to address it. I don't feel like I have to do it right this second. So
I keep my inbox is still kind of my file box. I've got things in my inbox from 20 years ago. So, yeah.
It works. Whatever works.
Yeah. So like I say,
I don't know how to get.
Oh, go ahead. You didn't know how to get rid of him.
I don't know how to get into his mind space, is what I'm saying. I mean, it works for me, so good for you.
Yeah, and so I think that unpredictable nature of DPC kind of stresses some people out. So even though it's the devil, right? It's like, well, I know how to address one thing with one patient and move on to the next. I don't know, at this point, sometimes people would think in their career, I don't really know that I want to spend an hour with a patient. What in the world? We'd get into so many different things, and, we'd talk about so many things. Would we really ever accomplish anything? So I don't think it's for everybody, but it certainly was. I just didn't feel like I could continue at that pace, or, I did want to answer those questions that I knew were unanswered from a 10 or 15 minute visit. And it wasn't sustainable for me, even though financially, like you said, that old practice was very sustainable. It wasn't sustainable from a personal standpoint for me.
Yeah. So tell us, what is success for you?
Yeah, I am, the interesting things, I've asked my family if they can tell a difference, and surprisingly, so much of what we carry, even those close to us don't realize how heavy the weight is, maybe. And even once that weight's gone, maybe they don't realize how much better you feel, because you can, especially as a mom, and as a wife, you continue to function maybe until you get to that breaking point. And I hadn't gotten to that necessarily breaking point where I'd had like a mental breakdown or anything, but I knew something needed to change. And I don't know that my family necessarily realized that as much as I did before we switched to direct primary care. Since my teenage son, he's 16, I've asked him that question. He said, well, you're home more. He's like, but you're still on your phone. You're answering messages from folks. He's like, so I might ask you a question. And you're like, what? Huh? Did you say something? So I have to make a mental note to be present, as well as actually there, so that is still a challenge. But there are things that I have to remind my husband. I'm like, we wouldn't be able to do this ever in the old method. I can stay at home and have breakfast and not get to the clinic until a little later in the morning. I can take my son to school before he got his driver's license. And so those kinds of things just didn't really happen. You were figuring out how to make it happen. Well, somebody's going to take you to school, or we're going to have somebody carpool today, or this is who's going to pick you up from school. But I was not the one that was ever really able to take care of those things on a day-to-day basis. And now I can breathe again. People talk about margin, and I do have some margins in my life now. It's not that I'm bored or anything like that. Nothing, far from it. But I have the time. I can actually eat breakfast sometimes. I can read a book sometimes. And every weekend my husband would ask me before, what are you doing this weekend? And my answer was always charts. And they just kind of accepted that, and they went about their way, and I would stay home and do charts a lot of times. And now my charts are done at the end of the day, and certainly done at the end of the week. So I guess even though your family loves you and cares for you, they sometimes still don't see that internal struggle. And when it's gone, they're relieved for you. But personally, I'm the one that realizes the absence of that weight more than anyone.
Yeah. And it does show. I mean, I'm sure, to your family. And one of the things is, I got to be careful. Last night, when we were at dinner, and Janet is more understanding than she should be. She should get on me more about it than I would be better about it. But, as we create more freedom in our lives because of technology, whether it be our phones or our computers, that we can, run our businesses anywhere in the world that way. Mm-hmm. It is hard to turn it off, because it's not, you don't see patients from 9 to 5. So right. You can work any time in the day. And, last night I was at dinner, I was on my phone the entire time trying to catch up because we didn't have internet service earlier and blah, blah, right. blah. And, yeah, so that is one of the things. It's hard to turn off. Now, I will say this, I'm justifying this. I was better when my kids were at home, but I need to really pay more attention to my wife. My wife is more important than my kids. I'm just going to say it.
Right, as it should be, yeah.
Well, I guess what we're really saying is we still have struggles in our lives about boundaries, but sure. I feel like the difference, at least for us, from the perspective of we aren't tied to, we weren't charting, but we were billing. We were constantly doing something to keep that flow managed. And I think stepping away from the insurance model freed us to be able to, like you say, offer services in a manner that we were comfortable doing and liked to do, and gave us professional reward. Because like mm-hmm. you said, some people don't feel comfortable getting out of that. But if I have somebody that I need to spend more time with, I don't have any guilt over it. I don't feel any pressure. It actually feels good to be able to address that person. And to me, professionally, that was something that I never had, even when we worked, for other people. It was always next. And I just didn't feel comfortable addressing other people that way, because I didn't want that for myself either. Sure. So the reward is different. It's a different feeling. And, maybe if people haven't experienced it, they don't really kind of understand that. But I feel like we all have this in our brain from the start of practicing about what it should look like. And if we're not practicing that way, I think that just keeps going along with us in that path.
Hey, Dr. Smith, you got some fans. Look at
awesome.
Look at this.
Hey, Mandy. Thanks for watching.
And check this one out. Lisa Ann Pierce. I want to read this one because this hits home to us too.
Yeah.
I know when Dr. Smith talked about starting DPC clinic, I wasn't too sure about it, but I love it. I can text her or call her anytime, and she always gets back to me. I love her and her staff members. They are all loving and kind. Thank you, Dr. Smith, for caring about your patients. Thank you, Lisa, for that comment.
Thank you, Lisa.
Yeah. And I will say, when Janet and I decided to go away from the insurance model in our pharmacy, there were a lot of naysayers, including family members, friends, patients, and employees. And so, when it does work out, it is, nice to be able to look back and say, it did work out, and we made the right decision. I could never go back to a traditional
No.
insurance billing pharmacy. And one of the things that we were able to do too in our pharmacy was, because we have fairly limited hours, half day Fridays, Monday through Friday, closed for lunch, all that good stuff, is we got to raise our family and travel on weekends when our kids were younger. And those are things you can never, ever get back.
Right.
Ever. And that's one thing that a lot of DPC doctors have said about their clinic, is that they've been able to spend more time with their family. And it appears that you have too. And those are times you'll never get back. And when you're 70 years old, God willing, you are never going to regret, oh, I didn't see another patient, or I didn't make more money, but you will regret not spending time with your family.
Right. No, I'm very, very glad I made the switch. You said, you can't really go back. I didn't really plan to go back when I made the switch, but it's kind of like, once you realize that your incentives and your patient's incentives are aligned in the same, direction, you don't feel like there's this conflict of interest all the time. And you start seeing more and more of the disparities in healthcare. I think we hear a lot about that as far as, access to care, even in the system. Well, we need to make sure healthcare is accessible to everyone, all this kind of thing. But yet the system is designed to keep people out of contact with their doctor. I mean, it's just designed not to work. Then you just realize, gosh, if I can get somebody their amlodipine for $1 for 3 months supply, or I can do their annual labs for $17.50, why in the world would I ever consider going back when it's going to cost hundreds of dollars for that lab, or they're going to pay a $15 copay for a medication that only costs $1? So it's like, once you've seen behind the curtain of the Wizard of Oz, like, there's no way I could go back and pretend not to know that there's a better way.
And I mean, the deeper in our experience, I mean, the further you get along in this, the further you will distance yourself and say, you could not pay me enough to go back. And that's where we're at. You could not pay me enough. And, it is, speaking of access, I didn't coin this term, Marion Moss did, but coverage does not equal care. So we always, politicians always want to brag about insurance coverage from people. And we got to get people covered on insurance, but coverage does not equal care. And you're talking about access. It's like, I know in our community, if you are a new patient in our community and you're trying to find a primary care doctor, you will be lucky if you can get in 12 months.
Right.
That is not access.
No, absolutely.
Who cares what insurance you have? You can't even find somebody to see you. I mean, it would be like Walmart advertising a special, but they never have it in stock. Seriously.
Yeah. No, exactly.
And it's so that's what I love about DPC is access. And if you want healthcare to get expensive, get insurance involved. When insurance isn't involved in healthcare, like you're talking about the labs, the pharmacy, your fees, that's affordable. That's very affordable. You want to make that not affordable? Get insurance involved.
Sure. Yeah, you've made some really great short videos about that with comparing it to how we would never put up with that if it was, when we went to get tires for our car or to purchase a hotel room, like you guys are staying on the road, and then find out what it costs 3 months later. It's ludicrous, but for some reason we've accepted that as the status quo in healthcare, and it doesn't have to be.
You've got more fans, man. You have a lot of fans. Look at this.
That's awesome.
I'm assuming this is your friend, family, patient. Is that correct, Pamela?
Yeah.
Okay. I love this model of healthcare, much more affordable than insurance. More importantly, I know how I have access to my fabulous doctor whenever I need her. She and her staff are amazing and deliver incredible service. Very grateful for Dr. Smith. Thank you for that comment. And,
that's awesome.
Yeah, it's so nice. It's so nice hearing things like this about your practice and about you, Dr. Smith. And I will say that we see this quite often in DPC clinics. And I'm just going to be honest with you. We were talking to somebody yesterday in healthcare, and she was talking about when she worked for a big hospital, one of the ways that they got reimbursed, which this blew me away. One of the ways they got reimbursed was based on their reviews online, which I thought, right. Okay. So you know about this.
Yeah.
Yeah. But you know what? I mean, here's my opinion. The doctors at a hospital have very little control about most of the things that are happening. So when that doctor gets a bad review, is it a bad review for the doctor? Or is it really a bad review for the hospital? Like wait times and all that kind of stuff.
Mm-hmm.
And so typically you don't see good reviews on doctors that work in big clinic settings. Is that correct? I mean, would you agree with that?
I mean, it's really hard to live up to, the expectations, the reasonable expectations that patients would have of their physicians. It's very hard. Have talked with, some pediatricians who said, I'm lucky to see my patients for their well child checks. And then I'm shocked to learn, well, they've been to the clinic maybe 3 or 4 times, but I was doing something else. I had other responsibilities to the hospital and to the clinic I worked for. So I had no idea when they come back to their next well check that they've had 3 or 4 ear infections. And oh my gosh, well, what happened there? And, what do we need to do about that? You just feel like you're behind the 8 ball the entire time. When your patients maybe then interpret that as, well, they didn't care or they didn't want to see me. Well, no, but there's just so many hours in a day, and you cannot do everything. And so it's an unfair expectation.
You got some more fans. Look at this.
Hey, hi, Beth. And Beth does billing, so she knows exactly the pain points that there are in the healthcare billing system. So, and she's still doing it. So way to go, Beth. I don't know how you're still doing it.
So, Dr. Smith, as we wrap this podcast up, tell us what you have a passion for.
I really have a passion for personal relationships with patients. And I think I would say, and Janet and I talked about this a little bit when we saw each other at a conference, when you're in a big setting where there's people all around you, I'm not that kind of people person. I hate that kind of environment where you're expected to hobnob with, everybody in the room or, make small talk, but to really connect with somebody and find out what their needs are and how you can make their life a little easier or a little better is not only my passion, but I think the passion of my staff. Like I said, they've both been in healthcare for 25 plus years. And Joni, my MA, just said it last week that it is a calling. She can't really imagine doing anything else. We love to, like I say, individualize our care and find out, it's not just checking these boxes to say, have you done these things that, like, say, well, then make me look like a better doctor? Have we done this, that, or the other that I'm going to get now reimbursed more for because I've checked your fall risk? I've asked you whether you drink alcohol too much, all this kind of thing. No, we are passionate about getting to know each person personally and then figuring out how the skills we have can make their lives better. And we want to do that for as many people as we can without compromising the care we're already providing to the patients who have entrusted us with that.
Wow. I love what you're doing. So if anybody has any questions, I'm streaming your website here.
Awesome.
If anybody has any questions or wants to get a hold of you, what's the best way to do that?
Well, through the website works really well as far as there is a email function. You can call us from that website and you can even enroll on our website. So that is one good launching pad to start from. We also have social media on both Facebook and Instagram and even TikTok here and there when I can remember how to put a video together. But those are all good ways to learn more about the practice and then just reach out. Like I say, we had somebody just earlier this week that they sent an email from our website that just said, tell me more about DPC. And that was it. And we let them have it. We're like, here's the whole enchilada. Here's what we're about. So we're happy to talk to new patients anytime.
I love that. So yeah, before we wind this podcast up, tell us about the name Pioneer Health DPC.
Yeah. So here in Stillwater, and we're in the Great Plains of Oklahoma. Our local high school mascot is the Pioneers, and so that was a natural name to consider, with that being our local mascot. But it also fits what we're doing in direct primary care. Family medicine is not new. Caring for patients the way we do is not new, but it is a breath of fresh air and kind of a return to, what used to be in healthcare to do this. So even though it's not new, it feels new and feels like we're pioneering in a way that makes a difference. So it fits in our locale for more than one reason.
Yeah, I was just going to say it fits for so many reasons. That's true.
Yeah.
So, all right. Well, thank you so much for being on our podcast and helping us to realize our goal, which is to educate and empower individuals to take charge of their own health. And I'm sure you do that every day with your patients.
We sure try.
Yeah. And listeners and viewers, thank you for tuning into Health Solutions with Shawn and Janet Needham. Tune in Monday to our regularly scheduled podcast, 12:30 to 1:30 Pacific Standard Time. Well, Sierra Brightbill will be talking about osteoporosis. So you don't want to miss out on that. And Dr. Smith, thank you so much for tuning in for being on our podcast today.
Absolutely. Happy to be here again. Thank you, guys.
You're welcome.